Hi, everyone. I would like to welcome you all to tonight's webinar. Today, this webinar is being put on for personal and professional rewards of community outreach engagement. It's presented by the American Student Dental Association's National Outreach Initiative with support from the Colgate Palmolive Company. Our outstanding speaker tonight is Dr. Renita Reyes. Dr. Reyes is a past president of the ADA Foundation and is the section chief of pediatric dentistry at the New York Presbyterian Brooklyn Methodist Hospital Division of Dental Medicine, where she has been included in the participation of the Colgate Bright Smiles, Bright Futures program, and as a component of the GPR program. But before we all get started, I just want to remind everyone of a few housekeeping items. All attendees should be muted so we don't pick up any background noise during the program. The webinar will be recorded and posted on ASDA's website, and a link will be emailed to all who register to the webinar next week. You'll notice the control panel to the right of your screen, and you can type questions into this screen, and it'll be added to the queue. The Q&A portion of the webinar will take place at the end. Now, let's get started. I'm happy to introduce Dr. Reyes.
Good evening. First of all, I must thank all of you for taking time out of your busy schedules and depending on your time zone for joining us as we go along a journey and navigate the pathway to community outreach programs and discover its impact on your success. Now, just let me and also understand how it impacts on your success as oral health providers. You've chosen a profession committed to the oral health well-being of those whose care has been entrusted to you. However, your success in fulfilling this goal is largely dependent on patient compliance. You will know that fairly often the patient's perception of the encounters with the dentist are not always confirmed by the reality of the encounters. You will note that, in fact, the patient will say, oh, I see my dentist regularly. I see him at the post office. I see him at the supermarket. I see him jogging. But how often do the patients actually see you in your office? We shall review approaching outreach programs based on age levels. Pediatric population, which will include youth and adolescents, adults, and the geriatric population. Now, quite often during the period of gestation, women do get prenatal care, and they get lots of information in terms of the developing fetus and what to expect. However, there is rarely an occasion when they actually get information regarding oral health. The impact of the mom's oral health on the developing fetus, the impact of feeding patterns on oral health of the child, and the need to really care for that oral cavity in the absence of teeth. They also don't get any information regarding the correlation between feeding patterns and oral health. Now, we know that early childhood caries is the most prevalent childhood disease. It is actually 5 times more prevalent than asthma, yet it is preventable. It relies on actual sharing of basic home care instructions to help prevent the incidence and the risk factors in the formation of early childhood caries. In fact, just a simple thing as wiping the gums after feeding can make all the difference, yet parents are not aware of this information. So your role in disseminating that information is critical. We talk about the young youth and adolescents, and there the risk factors are greater because of poor choices. I often refer to those who consume a lot of juice and sodas and sports drinks without understanding the risk factors associated with that consumption. And of course, they also drink bottled water, which is generally not fluoridated. Their choice in terms of snacks also impacts very much on the development of caries. They also tend to have oral piercings, not understanding the risk factors associated with oral piercings. The fact that the tongue is very vascular, the fact that very often the infection control protocol in these piercing shops does not measure up to what we as oral health providers are held to. So they have the risk of subsequent oral infections. Other habits include smoking, and smoking includes the use of e-cigarettes, which unfortunately develop many toxins as a result of the breakdown of some of the flavoring agents that are utilized. Many colleges do have what's called GASO, that's the Great American Smokeout Program. And you will see on this slide the involvement of one of my residents at a local college on their Great American Smokeout Day. And of course, ADA, through its National Children's Dental Health Month program, always has a theme that focuses on the importance of oral health wellness. So this year, the theme is brush your teeth with fluoride toothpaste and clean between your teeth for a healthy smile. It's rather simplistic, but in fact, it focuses on the need for brushing and flossing. The other major culprit, and this is critical when you're doing presentations to really have this information at your fingertips, is the consumption of soft drinks. And we're looking not only in terms of the sugar content, but certainly in terms of the pH level. We know from experience that we have what I refer to as the decay equation. That is, the consumption of sugar products the sugars interact with the bacteria in the saliva. They've converted to acids, and that acid then demineralizes the enamel. Well, not only are we concerned about the sugars, but we're also concerned about the pH of the beverages that are consumed. One of the factors that you need to look at is look at the pH of most of these diet drinks and look at the pH of well, your saliva tends to be basically a neutral pH. Coffee, fairly neutral. And of course, tap water, especially if it's fluoridated, is very basic. But look then at the pH of your soft drinks and look at something like Mountain Dew. I think it's critical for you to have that information, but also know that the average can of soda actually has 2 servings, and most people consume it as if it were one. And the average amount, and I don't know if you're aware, but 5 milligrams of sugar is the equivalent of 1 teaspoon of sugar. Well, the average serving has 39 milligrams of sugar. So that's basically almost 8 teaspoons of sugar. You think of someone drinking that entire can of soda and the amount of sugar they're consuming. One of the approaches I use when I encouraging people to look at what they consume is to actually take a teaspoon of sugar, the equivalent of what's in the serving, and put it on a dish. And when they see the volume, I guarantee you they wouldn't sit down and consume that sugar on that level. But yet that's what's happening when they drink the soda. In the adult population, there's some background sounds. The In the adult population, the risk factors are different. We go from the high risk factors for caries in infants, toddlers, youth, and adolescents to the adult population where it becomes more periodontal disease. And of course, I tell the adults that there is no free ride. Now that their risk factor for caries has diminished, in fact, if they don't floss and really maintain maximum or optimum oral health, the risk factors for periodontal disease, which impacts the supporting structures for their teeth, is greater. So we have to convince them to floss in addition to brushing, and certainly that routine basic 6 month visit, or sometimes a 4 month or 3 month, depending on their status, becomes critical. And of course, the geriatric population is a very different uh, risk factor. We've moved from the era where it was common for the average geriatric patient to have a full upper and a full lower denture. Thank goodness, though, we now have other options to consider for that population, and they need to be aware of the options they can exercise. The fact that they don't have to always have extractions, they can have endo, they can have crown and bridge in the event that extractions become necessary, but given the state of the art, they now can have implants. Of course, many of these choices have significant financial considerations, but those choices do exist. And so when we're doing the outreach, we have to be cognizant of the specific needs based on not only age groups, but finances. But we still have an obligation to give them the information so they can make an informed consent. Never assume that finances is the only variable. Give them all of the ramifications of their needs and their choices that can be considered. Of course, we have the special needs population, and the special needs population is very vulnerable, and they're vulnerable predominantly because many of them are on medications that lead to dry mouth syndrome. They also, many of them are mouth breathers. They have poor hand-eye coordination, and they have strong gag reflexes. So those variables impact on the incidence of caries. The mouth breathers tend to have heavy calcareous buildup. Uh, the providers or the caregivers need to have information that will help them maintain optimum oral health practices and diminish the risk factors for that population. So, happiness is a healthy mouth. And we want you to understand how you can help your patients achieve this goal. As you know, the mouth is the portal to the body. All meaningful experiences begin in the oral cavity from birth. The newborn's ability to survive outside of the womb begins with the initial exchange of oxygen, which is initiated by the opening of the mouth, which is stimulated by a nice little slap on the gluteus maximus. And again, the mouth is the gateway to the body. And of course, again, all essential experiences begin through the oral cavity, which means that we have a major role to play in wellness. We will now review programs based on local or regional considerations, national programs, and international and global programs. You want to help your patients understand that there is a partnership that must exist. In order to achieve the desired clinical outcomes, you must accept the responsibility of enhancing the dental IQ of the patient so that they may value your clinical proficiency and their role in maintaining optimum oral health. Your successful clinical outcomes are dependent upon the relationship between clinician and patients. You have to get them to understand that it is a partnership. You are not a mechanic. In fact, because you are largely dependent on their compliance for success, they must own the responsibility of partnering with you. The following roadmap will provide the pathway to successfully engage the community of interest and establish a collaborative relationship that will benefit the communities at large. And of course, there is a wide range of sites in which you may participate or present, including educational programs, perform risk assessments, render actual clinical services, including Missions of Mercy and Dental Home Initiative. Educational programs will range from various venues. On the far left, my far left, which may be your far right, depending on what you're looking how you're facing the screen, we've done programs in a church setting, basic community setting. We've done programs in schools, including the college program for the Great American Smokeout. And of course, in community outreach facilities. You can perform risk assessment almost anywhere because risk assessment simply means doing a preliminary screening to set priorities, to determine who has got the greatest risk and when and how to refer. So you'll see that we do it for infants and children. Of course, I am a pediatric dentist, and as a pediatric dentist, my focus is being proactive and reducing the risk factors to eliminate early childhood caries. My feeling is an ounce of prevention is certainly worth a pound of cure, and it is cost effective. And I am going to be candid with you. I saw adult populations for a number of years, but then decided that peds was where I should invest my time. And the reason I did that was because I got tired of listening to adults say, I hate the dentist. It's always so painful. It hurts no matter what they say. And it's so expensive. Well, the bottom line is that we as oral health providers are part of the solution to the problem. We are not the cause of the problem. But patients, unfortunately, don't have that same perspective on what our role is. So, this is one of the major reasons why Your involvement in outreach is so critical. And your ADA, your professional organization, is front and center and valuable to you. It is a major resource for oral health information focused on all aspects of our profession and the patient's needs. They're objective in their presentations. They're not selling a product other than oral health wellness and access to care. They're not selling a dentifrice. They're not selling a new technique. And if you are a member of ADA, you certainly do get reduced membership rates for anything that you purchase. Another member benefit. Of course, the ADA Foundation, through its Give Kids a Smile program, proactively provides a comprehensive program to afford access to care for children across the nation, particularly in underserved communities. For those of you who are not aware, this program was initiated 15 years ago through the efforts of Dr. Jeff Dalen of St. Louis. And it has grown from a program to a movement impacting the oral health well-being of the children of our nation. Through corporate collaborations and support, 5.5 million children have been served to date. The projected number of children to be seen this year will be in excess of 300,000 children. Now, if you haven't registered yet, it may be a bit too late to register, but there are materials available. You can actually go on the website for the ADA Foundation and download a lot of the educational materials that will be useful in your programs. Give Kids a Smile is always celebrated the first Friday in February. And of course, you know that February has been designated as National Children's Dental Health Month. I think back at the genesis of this program because years ago it was National Children's Dental Health Day, and it grew from National Children's Dental Health Day to National Children's Dental Health Week, and now, of course, it's National Children's Dental Health Month. That just confirms the great need that was uncovered for us to be proactive and increase access to care. Of course, the ADA Foundation has really been so proactive and innovative. They have now partnered with Scholastics to develop what's called the Tiny Smiles program, whose focus promoting dental health for young children. And our definition of young children is 0 to 5 years of age. And it starts actually with the prenatal care. The focus is to get mothers to understand that their own oral health will impact the development of that fetus. In fact, we know that women with periodontal disease tend to have low birth weight babies and have a greater incidence of having premature delivery. Of course, we also want them to understand once they've delivered that beautiful bundle, they have to be committed to maintaining their oral health, to understand the correlation between feeding and oral health, that on-demand nursing or bottle feeding will yield significant risk factors in terms of early childhood disease. And of course, we want them to understand that the primary dentition has a major role to play in terms of the occlusion of that child's teeth. So we don't want them to be at risk for premature tooth loss. The focus of the Tiny Smile program has been developed to target educators, dental professionals, and medical professionals as resources in the battle to reduce early childhood caries. So we focus on the OBs, nurse practitioners, midwives. We focus on the preschool or early childhood educators, the pediatricians, and of course on the dental profession, because we know that we don't have enough and will never have enough pediatric dentists to service the oral health needs of all the children of our nation. However, general practitioners should be cognizant of all the risk factors involved in caries and what their role can be in servicing the needs of the patients they see. The initial pilot programs, and at this point it is just a pilot project before we go national, is being conducted in Brooklyn, which is my jurisdiction, St. Louis, and in Chicago. And you will actually be able to access through the ADA Foundation website material that you can use to target or to interact with that population. Of course, the venues of program range from individual private practice, dental schools, residency programs, public and private community clinics, school settings, including parochial, public, independent, and charter schools, churches, community facilities, and even libraries. You will see that we've done programs in parks. We've done programs at Chuck E. Cheese. We've done programs in schools. And we've done programs in libraries. The collaboration with corporate entities such as Colgate's Bright Smile, Bright Future project enhances the range of access through their ability to have volunteers, programs, oral health screenings, do risk assessments, oral health education, and referrals of children identified as high risk. The venues in which the Colgate Bright Smile, Bright Future van serves include shopping centers, schools, parks, areas where the at-risk communities may be reached. On a local level, early childhood education programs such as daycare centers, Head Starts, heavily rely on professionals to conduct educational programs for their students and in service programs for their staff. It's ironic that very often the children get snacks in these programs, but the educators and the providers don't really understand or are not aware of the impact of the snacks on oral health. For example, they always tend to give juice and cookies, especially graham cracker cookies. I don't know. And what they don't understand is that it would be better to give fruits. In addition to that, of course, we want them to understand the value of brushing the children's teeth after they get their lunch or their snack. And we also want them to be able to recognize how to manage trauma if a child falls in the school and how to really recognize the child that's in an oral health crisis, the child who comes into the school and has clinical evidence of severe early childhood caries, which is an entity that is not commonly recognized by the population at large. So we must focus on providing outreach programs for the daycare centers, the Head Start programs, and any early childhood preschool program. Now, I will tell you that we are often tapped by the local. Just give me a second to get some water. We often tap by local elected officials to provide professional community outreach programs. This is their way of confirming to their constituents the availability of resources within the jurisdiction that are largely supported through their actions. Of course, you know, right now we are very concerned about the reauthorization of the CHIP program. We're also very concerned about a number of legislative actions that may impact on the access to care by way of funding. So you will be at some point tapped as a resource, and you should always respond in the affirmative because it's a win-win situation. It's a situation in which you are helping the community, and at the same time, that legislator will remember you when we have to go to the legislators and ask for support in many of the challenges that we are confronted with, be it funding or be it regulatory. So make sure you get to know your local legislators, both the local, meaning the constituents, or the national. So you get to know your congressmen, get to know your senators. They will be able to help you if they've made that connection with you through your response to projects that they have actually funded or organized in their community. Now, the range of things you can do will include health fairs, back to school programs, and fitness programs. There is a gentleman in our area who says he's a former Mr. World. He's a bodybuilder. And in fact, I was very surprised when he contacted me requesting participation of dental in what he refers to as a children's sport and fitness expo, which means that somewhere along the line, he got the message that we were an integral part of wellness. He did programs on weight control. He included asthma control. He included nutritional programs, but he also included oral health. And if you respond in the affirmative when you get those requests, you'll be amazed at the outcome. It's again, I like to say it's a win-win situation because we are making a difference in terms of the dental IQ of the average lay person. Your activities are not limited to local or even national programs. I have been involved on a global level in international outreach programs. I've gone to Sri Lanka. As a matter of fact, I just returned from Sri Lanka in August of this, well, now this is 2018, so in August of 2017. And I was appalled at the number of children that were orphans, as well as the severity of their dental needs. And Sri Lanka only has one dental school. It's highly competitive to gain admissions. They don't have residency programs, but they do have government service. So when you complete your training as a dentist in Sri Lanka, you are expected to work in government facilities before even attempting to do private practice, and the incidence of private practice is minimal. But in spite of the government hospitals, there just isn't enough manpower to meet the needs of the population. So they welcome international uh, service groups. So we worked very hard. And of course, when you go, it's almost like a MASH unit. This facility that you see in the slide actually is a tea plantation. And the philanthropic uh, nature of this particular tea plantation owner is such that he, in fact, had a health component. He welcomed us, and he also has schools in his facility. I've also gone to Ecuador, and I found that in Ecuador, the number of programs were more extensive than obviously in Sri Lanka because Ecuador has several dental schools. So in Cuenca, Ecuador, which is where I spent my time, we collaborated with the local dental school, and the senior dental students came along with us and functions as assistants. And as the years went by, they became more involved in our project. Of course, there are several organizations that offer international outreach opportunities. And actually, you could also, through the ADA Foundation and a number of other foundations, uh, get funding to go internationally. For example, I know that in New York, Stony Brook has received funding from the ADA Foundation to go to Madagascar. I know that NYU has a group that has gone to Jamaica in the Caribbean, and Jamaica does have 2 dental schools now. So there's that collaborative relationship between United States dental facility, dental education, and uh, Jamaica. There is also programs that go to Guatemala, go to Honduras, go to Belize. NYU has also gone to Tanzania. But again, the opportunities are endless. There's the Help Volunteers Overseas, Dental Care International, Doctors Without Borders. There's a Smile Train. There are a lot of help teams through who receive funding through church groups that go again a number of ventures. They go as a team, so you will work with physicians, with eye specialists, oral surgeons. As a team, you will go to a number of facilities. Investing your time and talent to provide at-risk populations at large with oral health information will empower your patients to be active participants in their oral health wellness. And again, goes back to the fact that if you're heightening their dental IQ, you're giving them, you're empowering them with information that allows them to make good choices. You're making them own their responsibility in your partnership for their wellness. I guarantee you that the impact of your efforts will minimize catastrophic care, which provides for cost-effective outcomes. You know, if we can decrease the incidence of early childhood caries and not have to do pulpotomies and crowns or extractions and space maintenance, it impacts on your ability financially to provide care to a greater segment of the population. It also creates a compliant patient who will value oral health as a component of total health and wellness. Your stature in the community will be enhanced as that of a concerned professional, and your investment of time and talent will be rewarded by the patient's value of your services. An informed patient who understands and values the integration of the body systems, including the oral cavity, will understand and accept treatment plans that will enhance their wellness. I thank you for your time. Uh, and of course, you will have the opportunity to ask me questions, or I will respond to whatever your inquiries are. You know how to reach me.
Thank you, Dr. Reyes. We would now like to open up the program to your questions. So anyone with questions who has sent them in, we'll follow up with those now. I actually had a question, Dr. Reyes. I thought it was really great that you had brought up legislation and the power of using our voice to influence those in the political environment to raise awareness of these programs and how we can support them. I was wondering if you had heard any success on laws such as that tax sweetened beverages, because I know that was something that recently came out in my state, and I was curious as to see if that was something that was beneficial or and an alternative we could focus our energy on besides all the awareness programs too.
Well, I will tell you, it's been an uphill battle because, for example, in New York, we had a mayor who was very concerned about supersizing and about, he actually took the vending machines out of the Department of Education facilities because schools tended to have vending machines that had sodas, had cookies, etc. And of course, that was another way of the school raising funds. Uh, I often cringe at when school groups have fundraisers, and the one thing that they sell most is candy because it is one of those things where they get the greatest return for their investment. However, the I would say the sugar lobby, and I don't really want to start another political battle because I often find myself in those situations. But the sugar lobby is very, very powerful. I can tell you that in New York, we came up with what I call Sugarless Wednesday. And I did this, I hate to admit, for 20 plus years ago. And I met with the person who was in charge of the food service industry for the Department of Education. And she told me unequivocally that they could not participate. They make their own ice cream. And in order for ice cream to be called ice cream, there were certain components, and sugar was a major component. And if she had to not serve ice cream or sugar on that particular day, one day of the year. I basically proposed this based on the model that was used for the Great American Smokeout. And I didn't want them to have no sugars on the day. I explained that it was a matter of raising the consciousness of all the sugars, or what I refer to as non essential dietary sugars that are consumed. And I think that children, especially, are reasonably intelligent people. And if in fact you teach them to read labels and you show them how to have a balance, because dessert is legal, and you get them to understand when they read the label, they are then empowered to make choices. They will, in fact, be compliant. I'm amazed at the children who will say, "Oh, I can't have that. I can't have a donut and a Coke. That's not breakfast. That's consuming overload." And when you look at the labels and you see all the hidden sugars that exist, we really are overloading. And then when you think of the supersizing, I told you about a can of soda, 12 ounces, is 2 servings. but no one drinks just one serving. And they don't recognize the amount of sugars they're having. So, from a legislative point of view, we have tried. We have not had the success we really need simply because of the political power of the sugar lobby. But doesn't mean that we should give up. I think my approach to that challenge is to teach young people and teach adults as well to read labels because we have a high incidence of type 2 diabetes in the young population. We know by definition type 2 diabetes is basically adult onset diabetes, but you have a number of 9 and 10-year olds who are now being diagnosed with type 2 diabetes. And it's all based on environment. I talk to them about nature versus nurture, and nature representing the genetic input, but nurture representing the environmental input. And if we can really, again, teach them to be selective in their choices. For example, I know that Canadians tend to have hot apple pie with sharp cheddar cheese. Now, I don't know if they really understand the impact of that combination. However, the sharp cheddar cheese, the protein actually buffers the saliva in terms of the acid that's formed from the sugars in the apple pie. So you can have your cake and eat it in a sense. I hope that answers your question.
Oh no, that definitely does. I think that was some really great insight into how it applies in so many different areas. I was just also wondering if you had a specific call to action that dental students could do every day, given the populations that we see. Like some of them, they might be pediatric patients, but for the general population of patients that we see, it's kind of a variety. What can we do to most benefit patients on a daily basis?
Well, on a daily basis, emphasize oral health instruction, oral health information. As you have the patient in the chair, he or she's a captive audience. I know you're concentrating on your preps or whatever procedures you're doing for the moment, but you must incorporate oral health education. This is, excuse me. This is why I value the ADA so much because the ADA certainly has enough materials that you can access. And I can tell you that in many programs, you can get grants for oral health projects. And I mean across the board. I mean, as a pediatric dentist, my focus is, you know, prevention, early access, early intervention. However, as a licensed oral health practitioner, I feel the compassion for the entire spectrum. So you need to find a way of getting your school to identify, for example, nursing homes, to do projects, many corporate entities, and maybe my feeling is that if we incorporate this in your DNA while you're in dental school, when you move on and either go to a hospital residency program or a federally qualified community health center, you will understand that you can be proactive and really service the population at large. You can service by partnering with many corporate entities. I can tell you that IBM years ago would have wellness programs for their employees, and they would call in dentists and other healthcare providers for that one day to do screenings and do education programs. You can, with I like Colgate just because they're so generous. They make a lot of products that we can use across the board. I mean, through the foundation, we do a lot with them in terms of Give Kids a Smile, but they do also provide material for other populations. Okay, so reach out to corporate entities, because they want to partner with us.
Thank you for that call to action. And thank you to Colgate for sponsoring so many of our community outreach events and things that we're passionate about, especially initiatives that we're passionate about. I think that's all the questions we have for now. So thank you so much, Dr. Reyes, for coming and talking to us about the importance of community outreach and how we can best serve those in the surrounding populations around us. Dr. Reyes has provided her contact information. If you have any follow-up questions for her, they're listed on the last slide of the webinar. We would like to thank you for participating in tonight's program. To help us evaluate this program and the need for future programs, we'll be sending out a brief survey and would really, truly appreciate it if you could take just a few minutes to fill this out. This webinar has been recorded and all registrants will receive a link to access the recording by the end of next week. Have a wonderful evening, everyone, and thank you again to our outstanding speaker, Dr. Reyes.
My pleasure.